Hi, good evening, everyone. I'm Dr. Punyajit Vargampaya. I'll be the moderator this evening. I would like to warmly welcome you all to this webinar on GP's role in occupational health and safety. Our guest speaker this evening is Dr. Asela Anthony, consultant family physician. He graduated from the Faculty of Medicine, University of Colombo in 1998. He's a member of the College of General Practitioners since 2008. He currently works as a consultant family physician and senior lecturer at the Department of Family Medicine, Faculty of Medicine, University of Colombo. He is also a member of the Board of Study in Family Medicine at the PGIM and also a lecturer, examiner, and a convener MCQ co at the PGIM. He is also the MRCGP International OSCE convener for Sri Lanka, and he is a member of the OSCE core group. He was an examiner at the MCGP exam for many years, and he is the chief examiner for the MCGP exit exam in 2026. He has a diploma in occupational health and safety. He was also involved in organizing and conducting the first occupational health certificate course of the CGPSL in collaboration with NIOSH and ILO in 2010. Before I hand over to Dr. Asela, can everyone please mute your mics, and also could you can ask your questions at the end of the presentation, or you can send your queries via the chat. Thank you very much. Over to you, Dr. Asela.
Thank you, Dr. Punajit, for that kind introduction. Am I echoing?
No, we can hear you clearly, Doctor.
Okay. Thank you, Dr. Punajit, for that kind introduction. Good evening to all. Today, I'll be doing the CME on for GPs who are working in their clinics, and it is not focused on doctors who are working for companies, because it will be different since we have a lot of GPs here. This will be focused on doctors who are working in their clinics. And will I be able to share my have I got the rights to share my?
Yes, Doctor.
Yes,
you can.
All
yes,
right.
You can share.
Right. So, as you all know, occupational health is a very, very important area in our practices, and almost all are related to, I would say, occupational related diseases. Just give me a second till I start sharing my. Yeah, can you all see the?
Yes.
Can you see the?
Yes.
Right. Okay.
Now we can see the slides.
Great. So this will be focused on day-to-day general practice, and not for office. Sorry, for occupational health. I mean, GPs who are working for companies.
Dr. Asela, we can't hear you.
Yeah. Hold on. Can you hear me now? Hello.
Yes, can you?
Yeah. Okay.
Yeah. Okay.
Yeah. Right. Are my slides moving?
Yes. Yeah.
Right. So I have chosen 3 patients that I have seen, and I'm sure that all of you all see this kind of patients in your daily clinics. So the first patient is Ms. Tilanka, presenting with chronic neck and shoulder pain. Just give me a second. Yeah, right. Sorry. Right. So for a duration of 6 months, it gets better with medication, but comes back again from time to time. The second patient is Mr. Pereira, 55 years, requests for a fitness certificate. He has features of diabetes, and in his investigation shows HbA1c of 10.2 and fasting blood sugar of 180, which these reports are done for the first time, and he's a newly diagnosed patient with diabetes. Case 3 of the patient 3 is Mr. Supun, 40 years, presents with progressive shortness of breath and chronic cough over the past 2 years. So I'm sure that all of you all have seen this type of patients, regularly in your clinic. But do we think that it is occupation related? So what are the factors that indicate a relationship to occupational health? I would say the working, all are in the working age group, right? And then there is chronic and recurrent symptoms. And the symptoms affect, sorry, the systems affected are those related to occupational health, musculoskeletal, respiratory, and I would say in some jobs, lifestyle is also connected to their job. We will discuss this later. We will first see what occupational health is. So the ILO defines occupational health as bringing together many disciplines to ensure workplace, thereby preventing accidents and diseases. That is the most important thing, which is highlighted in blue, and actively promoting safety and health at work and introducing a safety culture. So this is we are dealing or we are trying to prevent accidents and diseases and actively promote safety and health. But this is not our job as a GP in our clinics. And what are hazards and risks? These are terms that are used in occupational health. A hazard is a source of harm. As you all know, electricity, chemicals, then fire. There are so many sources of harm that can cause injury to a person. Or it can be chemicals or dust that can cause illnesses in the patient or the person. A risk is the likelihood of damage or injury to the person plus its severity, right? So a harm or hazard being there does not affect a person unless there is a risk. So I hope you all will understand this. These are just terms that you all will see when you all are reading on occupational health. So I have given a few examples, like a broken electric cord. We all know that we can get electrocuted. If we have a wet flow, we can fall. And if we have toxic chemicals, which will affect our lungs and cause issues. Right. What are the hazards that a GP, what we will see in a GP clinic? So our clinics are also, we'll say it's a place where you can have, it's a place where occupational hazards are there and occupational risks are there. So what will you all think about what we have in a GP clinic? A hazard, obviously, where we will have electrical cords, then we will have, if we are, using hot water, burn injuries. So hazards are there. And the likelihood of reducing these hazards. So we have to be careful that the electrical cords are well insulated, it's not on the way, and all the precautions are taken that there is no risks to the persons working as well as the patients who are visiting us. So if you look, it will be easier for you all to understand occupational health if you all concentrate on your clinics. and you all will see the risks and hazards. And how do we mitigate or prevent these hazards from causing issues or risk? So the first thing is to eliminate, remove the physical hazard, right? Then substitution, replacing hazard. So from medical terms, in medicine, we have reduced some chemicals that we are using. Now we use different chemicals like that. Engineering controls, if we take X-ray, right? So we isolate the patient, the people who are doing the X-rays. Now we have lead partitions, and the people who are the technicians are outside the room. Or we can have administrative controls, change the way people work. So that is, we say, okay, you can work in the X-ray room only this amount of hours. You can't work more than that. And also we can tag them with X-ray radiation sensitive, those gadgets, so that we know how much they are getting exposed. And also we use protective equipment like lead, the jackets we use if we have to go into the X-ray room. So these are the control measures we use when there is a hazard to control the risk. Why is occupational health?
Can everyone mute your mics, please?
Right.
Dr. Pinto, can you mute your mic, please?
Why is occupational health important for GPs? Because most Sri Lankan workers first consult GPs for their own illnesses. They are the first contact care people. So all the people will come seeking help from us. Also, occupational diseases are under-recognized by the workers and also doctors. By the workers, why? They think, okay, this is something that is part and parcel of the work, which is not, right? We should not allow work to harm the worker. And also as doctors, we also might not think, okay, whether this is related to work. So occupational diseases are under-recognized. And there are a large workforce we call formal and informal. Formal is where the workforce is registered and they are under the government laws. Informal workforce is they are not under government regulation. We will discuss this in the future as well. And also we don't have many occupational health physicians to manage all the issues that is related to occupational health. We have occupational health related nurses, we have occupational related safety officers, but we don't have many occupational health physicians. But early intervention by the GP, that is you, will keep this person safe and prevent diseases, disability, and death, because occupational hazards can cause even death. Am I going too fast? Hello. Can you all hear me?
Yes, we can hear you clearly, Dr. Asela. All good.
Am I going too fast? No?
Sir,
No,
it's
that's
okay.
fine. All fine. All fine.
Okay, right. So, this is from the International Labour Organization. They have worked out the deaths attributed to occupational health, right? So, if you see the most deaths are occurring due to exposure to long working hours, right? So, I mean, this is in different occupations, but working long or working hours is the main cause for a death which is related to occupational health. This can be due to, not working, say, on a machine throughout, but they can be so tired, and when they are going home, they can meet with an accident, or they can injure because they are tired, they can fall onto the machine. So different ways of death, but due to the long hours of work. Then I'm sure you all know about particulate matter, gases, fumes. We have had some blasts and injured fires which have killed workers. And occupational injuries, like if there's a blast, the shrapnel can go like a bullet and injure people. Also, there are machines which have killed people. And occupational, still this happens because sometimes the asbestos, which can cause cancer, because in some areas, still I think our some items are even in cars, some items are made out of asbestos. And silica, asthma is still a problem like that. These are the main 10 causes which causes death, which are related to occupational. And so this is the what we call, I mean, these people are not dead, but they lose their valuable working life in years, disability adjusted life years, right? So what happens is, say someone can work till 65, but due to some issue, occupational related issue, they can work only up to 60 years. So they have lost 5 years of work life, and that is so 1 year is called disability adjusted life year, right? So in this, the 10 condition, occupational injuries come first, ensuring long hours also comes second. So this was causing deaths in that previous slide, and here it is second. I think as doctors, we also might fall into this category, right? Because we are working long hours from morning till late. So, and research has shown, if you are working more than 55 hours per week, you are at risk of having these issues. Then occupational ergonomics. Again, we are also fall into this category because we are seated all the time. We don't have time to exercise. We don't, are in the same posture, right? And so the list goes on, right? So if we look at statistics from Sri Lanka, right? These are injuries, not all occupational health issues. Out of 100,000, 21 people have got injured. So that's a lot. And out of 200,000, sorry, 100,000, this is, out of 200,000 people, one person has died, right? So I said we don't have occupational doctors, but we also don't have enough inspectors to inspect these formal occupations. We have only 0.6. And also in a seminar conducted in 2023, it was reported that out of 26 out of 100,000 people working age die from diseases due to occupational risks. This is Sri Lankan statistics from the ministry. And we are the third highest among the 11 South Asian region countries. So our track record on occupational health is not really good. And like I said before, nearly 67% of the population are from the informal sector. I will discuss about what the informal sector is. So this sector is, so you can see 67%. A lot of people are in informal occupational sector. And 12% of the working population in Sri Lanka are exposed to long working hours. I think we also belong to this 12%.
Dr. Pinto, can you mute your mic, please? Dr. Pinto?
I think we might have to call him, no? So
we will call him, Doctor. Yes.
Yeah. So, this is a slide on formal and informal occupations. Right, thank you. So this is what I was talking about, formal and informal occupations. Formal occupations are governed by other, say, garment factory workers, plantation and agricultural workers, construction and quarry workers, bus, lorry and train drivers, healthcare workers like us, and teachers and office workers. So healthcare workers, if you are in the private sector, totally you might fall into informal sector also. So informal sector is street vending, where they have their shops by the side of the road, three-wheel drivers, which is not regulated, daily wage, construction and agricultural, day laborers, domestic workers, small-scale fishing, home-based food production, and when they do home industries like garment, piecework, tailoring. So what are the differences between formal and informal? So formal is registered with the government and monitored by the government. So they are under the labor law. So they have to adhere to labor laws and other laws in the country. And they have contracts with the employees, and so they have set hours. I mean, if you know the labor laws, you can't have anyone working for more than 8 hours. You have to give rest. You can't have females working after 8. If they are working, you have to give transport and all. Those regulations are there when you are under the formal sector. And there is job security. I mean, you get paid at the end of the month. But informal sector, there are no regulations. No one looks at them. No one, is I can't say worried. No one is worried, but it is not regulated. So, like I showed before, 67% of our workforce is informal. So they are generally unregistered, unmonitored, rarely have contracts or benefits, and they have no job security because they earn on a daily basis. So if you all as general practitioners think this category is the most, in our client base, this might be the biggest category, because here they have some rights, they can they are looked after, but here no one to look after them. So we are responsible there for their health and safety. So what is the role of the GP? Like I said, we are the because we don't have many occupational health specialists. We are the gatekeepers for the whole country for or the workers. What are the roles of occupational health gatekeeper that we play? Like I've told you before, first contact. So the patient comes to us first, right? Remember, I mean, if you reflect back on your yesterday's client, people who came to get medicine, right? You are the first contact, first where they will seek help. And early identification of occupational health aspects and the condition. So every time, if you are able to identify this, you are a good gatekeeper. And not only that it is related to occupation, if we can identify the hazard that they are exposed to and the risk involved. Say someone comes with asthma, we'll say, and okay, it's easy to diagnose asthma, and we know how to manage asthma, right? But if we can think, okay, whether this is originating from occupational health condition or the environment, so we are into this the second line. But if we can ask that person, okay, what are the things that he's doing, whether he's working on a lathe machine, whether he's on a carpentry machine, right? And whether whether he's using any equipment, personal protective equipment, we can reduce the risk. We will be managing him on the third line. And proper management conditions, right? We have to manage, like I told, so asthma, we have to manage, have a good knowledge on managing asthma in addition to this occupational part also, right? And then we can say that, okay, say someone is working in a carpentry shop. We can say, okay, avoid dust. That is not going to help this person because he has to earn his wage and he doesn't know, I mean, he might not know, especially in the informal sector, what to use, whether it is the surgical mask or whether it's a industrial mask that needs to be worn, right? So our knowledge on what action to take for prevention will help. And also this is very, very important to educate the person or the patient about the hazard and the risk involved, because otherwise all of you all will know wearing a personal protective equipment is not easy. So they will not make use of this equipment even if they are given. I'm sure that you all have seen, I mean, they have it, say, the glasses which are given for protection of the eye. They have it on their forehead and they do arc welding, which is very, very dangerous. And also, as a gatekeeper, we have to prevent disability and death through advocacy and safer workplaces. So our advocacy part will be, we can communicate with the office or their factory or wherever they are working, not to fight, not to have an argument on you're not doing your job, but for the sake of the people, because these people are also dependent on their jobs. We can't put them out of the job, but we have to make sure that everyone is safe and they can continue to work in that same place. So like I said, balancing clinical and legal responsibility is very, very important, right? Because we can't go and put a case against we can, but it's a long legal process if we are going to put a case against someone, right? Say our patient is has got some issue because of that, right? So we have to balance. I think that's why early identification is very, very important, so that we don't have to go to legal issues. Right. So recognizing work-related illnesses. I've given a few clues before also. Like I said, any patient I will consider between 16 and, because 16 is the age that a person can start working, and 65, I mean, that is the retirement age, but people work till 80s or 90s or whatever, right? So, but if a person comes within this age, we always have to think whether that condition is related to occupational issues. Then, if the symptoms, if the condition is worse at work or towards the end of the working day, right? Again, we can think, okay, this is something which is originating from the occupational, his job. And so, while he's working, it gets worse, but it improves during weekends and holidays. So weekends we might not be able to really identify, because sometimes they work for 6 days, right? Only Sundays off. So, but still we can ask. But if they go on a holiday for 3 or 4 days away from that working environment, that will clearly indicate that it is caused by the working environment. Also, if they have other people who are down with the same issue, right? If they are co-workers or are also down with the same issue, we can think, okay, this is originating from the same job. Also, when we try to manage something and it keeps on recurring, or something chronic where we find it difficult to manage, I mean, compared to a normal person, we find it difficult to manage, right? Or unexplained illnesses. So there was a patient who was a driver, and he came with a definite contact dermatitis on his hands, right? So I asked him, okay, what, I mean, his job and all that. I went into detail, but I couldn't find any reason to get this contact dermatitis. Then on day 2, I think, again I asked, okay, now tell me, I mean, don't worry, because they are also worried about their job security and all that, right? So I asked, so tell me, what is, I mean, what do you do after you go back home? To see, they were doing some, making some purses, I mean, leather wallets, and they were curing the leather with some chemical, right? So we might have to ask other other jobs that they might do part-time in addition to their main job. So always ask, what is your job, right? And ask, do you engage in other jobs? Because this might be the clue to the main issue. Also, you can ask, do you think that the illness is related to your work, right? All this because when you come to a this unexplained illness, we can't from our the usual practice, we can't explain what is going on, right? So in that case, these questions will help you to diagnose. So right, so this is another concept of occupational health. The person should fit the job, and the job should fit the person, right? So for example, we'll say there is a person who has applied for a airline job, right, as a air hostess, and her height is, we'll say, 4 feet, right? I really can't remember what the regulation is, right? But we'll just say that the height is 4 feet, right? And so she might be totally fit and all that, but she might not fit the job, because I mean, air hostesses have to put luggage on the top the cabin, the storing area, right? So those she's fit, she will not fit the job, right? So this has to be there for a person to nicely fit into that job. And when we do assessments for jobs, fitness for work or is different from fitness for all tasks, right? So here it is a job, right? we can't say when we are giving a medical or we're doing a medical, for a company, we should specifically say, okay, this person fits into this job, right? Because if they put him into a separate job, there will be a problem. So, say, like, for example, someone is colorblind, right? And he goes for some job where color is important, but so he does not come into this category, but they take him for some other job and they decide to put, okay, for temporary, or even they decide to put him to that job where they need color, right? So when we specify in a medical, we have to specify the job. Also, temporary versus permanent restrictions. When we say temporary, say if someone has I say, we'll say there is viral conjunctivitis, right? So they temporarily can't go to work, right? Because of a few things. One thing is he's sick, and second thing is he can give this issue to others in the working environment, right? But someone else can have a eye injury and he will not be temporary, but he will be permanently restricted from doing that job. Also, we have to consider about public safety. When we are, say, signing for a driving license, we have to be careful if we sign for public transport, because we should not allow people who have restrictions, permanent restrictions, to handle public transport. And also, this is very, very important, we have to make clear documental evidence, because if someone says, okay, right, so for example, someone goes to work in a very noisy area, right? And he develops, hearing impairment later on. So we have to show that it is related to occupation. We should have conducted a hearing test before he was employed. Otherwise, we can always say, even if he had a deficiency before that, it developed because of the occupation. So it is very, very important that we clearly document the findings, and we have to do a thorough job in doing the medical also. So managing occupational injuries and diseases, what are the common presentations? I'm sure all of you all have managed or will be managing and low back pain, and I'm sure some of you all will be having low back pain because of long term sitting, and in the wrong ergonomics are wrong, right? We also will have shoulder pain, because supraspinatus, all that muscle will be in spasm due to our working long hours. Occupational asthma is very, very common because of the dusty environments, not using proper personal protective equipment, and so on. Contact dermatitis is very, very common because a lot of chemicals are used. Say people who are using, we'll say, attending to cars, they will get grease and oil on their hands, so they will use soap or some washing liquid recurrently, right? So that will cause dermatitis. Noise-induced hearing loss is not very, very common because it is well documented, well looked after by the companies. And informal sector, we don't have a lot of noisy areas, right? So this is not a big problem, but a huge issue unless, if we don't do the medical properly and they develop hearing loss. Stress and burnout, right? I think we are also part of this issue, all doctors, right? We are also running, from morning till evening. So if you look at this, I mean, we also work long hours, low back pain, shoulder pain, and stress and burnout. I'm sure that most of our doctors are also fall into these occupational health issues. These are not the full list, right? There are so many other things that can go on, but if what I want you all to do is, if someone comes with low back pain or shoulder pain or asthma, any skin condition, hearing loss if they are working in a very noisy environment, right? And stress and burnout, which is very, very difficult to identify and very, very difficult to pinpoint, especially if they are working in 2 or 3 jobs. Say, like the example that I gave, the driver, he works for whatever the company from 8 to 4, and then he goes and does his home industry from, I think, 5 to midnight, I think. So he sleeps only 4 hours. So all in all, he's stressed and burnt out, right? So I think we also might fall into that category. What are the medical legal responsibilities of the GP? Like I said, we are the gatekeepers of occupational health, right? We issue medical certificates, right? To whom do we issue? Why do we issue medical certificates? Because it is needed by the formal workforce, right? Informal workforce will not request medical certificates. So when we certify that someone is ill, we have to think about his job, his co-workers, whether he'll infect them. And so, for example, conjunctivitis, we can give 3 days, right? Chicken pox, sometimes 2 weeks, sometimes 3 weeks, right? So like that, when we issue medical certificates, we have to be sure about his job, where he's working, his co-workers, all that. And we should give medicals only for the duration, not short and not in excess also. And if we have not seen the patient, because medical certificate is a legal document, right? So I've seen some people saying that not for legal purposes, right? That does, in a court of law, it does not stand. So when you issue a medical certificate, you're issuing it to be submitted to, say, the office. So it becomes a legal document, right? So you can't say that I've said that it is not for legal purposes. It is a legal, even if you write that it is not for legal purposes, it will, if it find its way to a court of law, it will not, you will be called and to ask, okay, what is going on, right? So in this aspect, always keep a copy for you, so that because people have altered medical certificates and all that, so because of that, keep your own copy. And like I've been telling, don't issue medicals for patients that you have not seen and you have not treated. If someone says, okay, comes with a cut injury and it's healing, and he wants a medical certificate backdated, if you have not treated, please don't backdate, because you don't know what has happened, whether it was but the story is true, or whether he was in a fight, and so many things are happening these days. So you have to be careful. Second thing is fitness reports. So people will come and ask, doctor, please give me a fitness report, and they will always say, I am fit, doctor, don't worry, but I want, because I want the money and all that, right? So be careful, assess properly, because these reports also might end up in courts, or the person might be a risk to the public, right? So if they meet with an accident, then there will be a issue to say who gave the medical certificate, witness report. Then return to work advice, right? Say if after an injury, someone will want to return to work, and they will come and ask whether I'm fit to work, whether I have to change, say asthma patient, whether he's able to go back and work in the same environment. So you have the authority to discuss and advise even the office. Workman's compensation is a major issue because it will end up in courts anyway. So it is always, I think, better if you are not confident not to handle this area. Also, when we write, we have to write all these things, accurate, objective documentation, right? We have to be specific, and we should only write what we can see and diagnose. Don't put things which are not there. Right. So prevention and health promotion. This is also part of our job. Ergonomics. I hope you all know what ergonomics is. Ergonomic advice in routine consultations. So people will come with backache, shoulder pain, etc. So we have to advise them on ergonomics, right? How to sit, how to adjust the seat, how to adjust the laptop if they have issues. So work environment or the working desk or the work area has to suit the person. And like I said, educate on personal protective equipment, right? So this is the last, if you all can remember that upside down triangle, right? This is the last protection against any injury, right? So if they don't wear protection, it's going to be dangerous for these people, right? Those who have seen X-ray technicians, sometimes they just go, yeah, okay, doctor, I'm now 55, 56, so it's okay, I have, had my children and all that, but that is not the case. We have to use personal protective equipment. Heat stress prevention, say for outdoor workers, it need not be only people who are cultivating. Even people, say drivers, they are always on the road, and some drink water I've seen, but sometimes they might not drink water, or sometimes they might drink say Coca-Cola or whatever, right? And they are at risk of getting diabetes and everything else, right? We can also advise on vaccination. Those who are those who are working with blood, we can give them hepatitis A. Those who are working in industries where tetanus is, plausible, we can give tetanus toxoid. And those who are in animal husbandry, we can give rabies vaccine. So we have to give vaccination depending on their job. Also, leptospirosis. If you have people who are working in areas where leptospirosis can occur, we can give medication, right? Lifestyle modification. This is something I think you all will have to discuss with your patient, right? Because this is not identified as a occupational problem, because we always say, okay, eat from there, right? But the major categories that I've seen is those who are going those who are going around the country, like salesmen. They are here one day, they are in Anuradhapura the next day, and third day they are in Kurunagala. So they live in, not at home. So they eat all junk food or food which is not good, and also their environment is, they are happy eating and smoking and drinking. So we have to tell them about lifestyle modification. So this will they will come with NCDs, diabetes, pressure, cholesterol, heart issues. So we have to, they have to do their job while being careful about their health. Right. So GP as an advocate, right? We can, early detection will lead to disease prevention, right? Educating workers and families, right? Because families are also important, because as GPs we will come into contact with the family. Say someone has diabetes, right? We have to educate the family, make a parcel of rice which will suit a diabetic, right? And otherwise he will go out and eat from outside, and his control will be gone, right? Bringing health and workplace safety in Sri Lanka. As a GP, this is our job, because there is no one else to manage, or look after the health of the workforce, even in the formal sector or in the informal sector. Right. So we will go back to our cases, right? So 32-year-old Dilanka, presents with chronic neck and shoulder pain for 6 months duration. It gets better with medicine, but comes back again after some time. So she's a garment worker. She says it is worse in the evening and improves on weekends, and he has no neurological deficit. So what are the occupational risk factors that you all can identify in a garment worker to have this complication? I think you all can open your mics and we can discuss. What are the occupational risk factors, so that I've set this up for discussion so that we will understand what we are discussing? Can you all hear me?
Working.
Yeah, go on. Sorry.
Yes, we can hear you.
Yeah, longer working hours, definitely, right? So because they start from 8, they are seated in the same place, and sometimes if there's a order, they might go even up to 10. Yes. What else?
Their position during working hours.
Very good, right? So their position, they are seated the whole day, right? So that is a very, very important risk factor. Yes. What else?
Most of the government workers travel far distance using the transportations. So poor road facilities.
Yeah, but that can also contribute because they might be seated or standing, especially if standing, right? What else? Okay, what are the key questions that you all are going to ask this Miss Nilanka? So she has come, you all are all doctors. I'm sure you all have had patients with neck and shoulder pain. So we will focus on not other things, on occupational health questions.
What is her particular job? What type of job she is involved in?
That's right. Yeah, very good, right? Because when you say garment worker, there are many jobs. It can be sewing, it can be carrying done garments, right? So yeah, that's very important. What else?
How many hours they are working continuously?
Yeah, right. That is very, very important, right? So we have to know their working hours, like we have discussed. If they are working long hours have shown to be the main cause for deaths and the second cause for illness, right? Yeah, very good. What else?
Similar symptoms in her working colleagues.
Yeah, definitely, right? Because all of them will be doing the same job, and all of them will have the same form of illnesses. Right. So
other part-time jobs.
yes. So we have to ask about other part-time jobs, right? Very important. But if you know a garment worker, it's very, very difficult for them to, because they are all, I think, tired at the end of the day. They don't want to do other jobs, or they work long hours. And but your question is very, very important, right? So in the management plan, what are we going to discuss?
About her posture during work.
Yeah, so educating this person will be the most important thing, right? Educating about the posture, then what else?
So first we will have to assess how much it has affected her routine life or day-to-day life. Then only we can go for a proper management plan, is it?
Yeah, absolutely, right? Because we have to assess. I mean, I have just jumped that part, because I mean, how the disease affects her life is very, very, very important, right? But if you have seen these girls, they go on because they are given incentives, right? If you come every day, you get an incentive. If you stitch this many garments, you get an incentive, right? So that's how they are kept in that seat and asked to work long hours, right? Yeah, so I have right. So if you look at ergonomics, they are doing repetitive movements, right? It is like it's actually very robotic, right? Taking one garment, doing one small stitch or whatever, and sending the garment back, right? So it is very, very repetitive movements. And like you all said, poor working workstation ergonomics, the seat might not be right, the machine might not, the height might not be right, okay? And like you all discussed, prolonged static posture, right? They are like robots eating the whole day. And we can advise on, early physiotherapy, right? In addition to the medicines, we have to tell them about physiotherapy and specific exercises, because we can't say, okay, you better find another job, right? Because they have been trained on that job. If it is affecting their life, we'll have to change the job, but otherwise, we will always try to keep them in that job, right? And work modification to prevent chronic disability, right? So the GP's role is, in the first or second instance that we see, we have to detect and take actions for prevention, right? We can always, because these poor girls, they don't have the strength to go and speak to the management, right? But as doctors, we can always inform the management, okay, this is happening, and we have got several patients from that, and we can tell them, right? Right. So coming back to the second case, Mrs. Silva Pereira request. Sorry.
Don't you have to exclude any neurological deficits, any serious conditions? We are
No.
treating
That's
only
why.
symptomatically now. Yeah.
No. So that's why I say we are focusing only on occupational health.
Right. Okay.
Right. These conditions, all these conditions that we see in occupational health, will have other differential diagnosis. Right. We have to exclude red flags. We have to exclude other major.
Yeah.
Yeah. Right. We have to do that. Right. But since we can go into all the details, I'm just focusing on the occupational health section, right? So if we come back to 55-year-old Mr. Pereira, right? He has requested a fitness certificate. He has diabetes, newly diagnosed, right? And he wants to be a bus driver, right? And that's why he has come for a certificate. What do you all think? Will you all manage? Is he fit to drive?
No,
Why? Why not?
he can go into hyperglycemia, and even if start on treatment, he needs some window period to identify whether he's going for hypoglycemia and cause trouble during driving.
Exactly, right? Very good, right? Because now we can't let him just go up with this blood sugar levels. We have to treat him, right? So we have to stabilize him before he is allowed to go as a bus driver, right? What risks, like, yeah, so you said that it can be hyper or hypoglycemia, right? So hyperglycemia can it affect vision?
Yeah, yeah. You have to screen diabetic retinopathy and cataract. We have to screen.
Yeah, right. So you all know that diabetes can affect so many systems, right? And also when you have severe hyperglycemia, right? The lens, the lens focusing power might change if it is not under control, right? It is temporary. So we might have to look into, like you said, complications of diabetes, right? Should this be documented? Yes, like we have discussed, this should be documented, because if he goes and say that he has seen us and got the medical, we will be in trouble, right? So we have to document, right? So the key learning are, like you said, hyperglycemia, public safety implications, right? This is the most important thing. Temporary restriction till he is stabilized. We have to have a clear follow-up plan, right? He has to report till his control is very, very good. And balance livelihood versus safety, right? So if you all know these long haul buses, right? If you all watch news also, they take all sorts of things to stay awake, right? Because they fall asleep, they can take all sorts of things to stay awake, and they smoke and do all sorts of things. So their safety is quite at stake, and when they do that, the people who are traveling are also at risk, right? So here we have to make an ethical decision regarding him, the public, right? Because they will say, "Ayo, sir, give the medical. I'm sure that I'll be okay," right? So you have to be ethical on his request, as well as your responsibility towards public, right? Right. So Supun presents with progressive shortness of breath and cough. He's a Cory Burke, right? And his symptoms was during the week, right? So this is very obviously it is from the Cory dust, right? What are the GP level investigations that we can do?
Chest. Yeah.
Sorry?
You have to do a chest X-ray.
Yes. What you said was not clear. Actually, as a GP, we can do a lot of things, right? And refer for long-term management if we are not confident in, because it is related to Cory, the Cory does, right? So these people are generally informal workers. They don't have any legal rights and all that. So it's a bit of an issue, right? So suspect occupational lung disease, early spirometry, referral to specialist, because it is not like the normal particles. It is very difficult to manage this. They might end up with silicosis, right? That's case 4. An employer requests details of medical information about an employee with depression who is frequently absent. What can be disclosed? You are an independent GP.
We can't disclose the information.
Regarding information regarding what? So this area
Regarding
is
the regarding the is in illness and other things. So what sort of condition he is suffering and other things we can't disclose as it is a psychiatric disorder, because he will be labeled as a psychiatric patient.
yes, right. Any other views?
It is not a matter of the diagnosis or being labeling, but it is a breach of the patient's confidentiality.
Yes, right. So that is the main, ethical principle, right? Breach of confidentiality. And so how are we going to get over this issue? Now, we might have to give medicals because he's under our care for the frequent absenteeism. So when we write medicals, we sometimes say, okay, this is a condition. Can we write a condition? What are you going to put? He's just absent. What are the ethical and legal boundaries?
Without a proper training in either psychiatry or psychology, can we label a person as having depression? Or should that be, say, the diagnosis of a qualified psychiatrist?
Yeah, you are right, because if it goes to, no, I think you mild to moderate depression, you all can we can diagnose, right? But here, I think more than legal issues, we have to now, if the patient wants his job, right? Patient needs his job, and we can't put that's his lifeline, right? So how are we going to manage? So I think this is where a discussion is important between the patient, and also you can reach out to because the employee has reached out to you, right? So because of that, we can discuss with the employer. This is we can't disclose, but he's under treatment, but I can assure you that he will be back at work and he'll be okay and all that, right? So this is a bit of a ethical dilemma for us, right? Can you all remember the German wings accident or suicide accident, where the pilot crashed the aircraft into a hill? Can you remember? Right. So that the first officer was on medication from a qualified psychiatrist for depression, right? But it was not disclosed to the airline because of this issue of ethics, right? So the doctor was not found guilty, but a lot of people died, right? So sometimes we might have to, for public safety, like we discussed in that previous section, where the driver, regarding the driver, right? For public safety, we might have to breach barriers because otherwise a lot of people might be injured, right? So here I think I have not come across. It's a dilemma, we'll say, right? So that's why we have to discuss this, and so confidentiality is paramount, right? And sharing functional capacity, we can do. Whether he can do the work, whether he can't do the work, right? But we can stay without giving the diagnosis. Say if he's so if we take the Germanwings pilot, the doctor could have given a medical saying that he's not fit to fly or to engage in his capacity as a pilot, right? And he's under treatment and under my care, right? We can give that without giving a diagnosis. But if we are going to give a diagnosis, we have to get consent, and it is always better, depending on the person, right, to get written consent, because otherwise it might backfire on us. Also, confidentiality is paramount because we have to protect the therapeutic relationship we have with the our patient, right? Right. So I think this is the last case. A 20-year-old agricultural worker presents with repeated skin rashes after spraying pesticide, which is, I mean, I'm sure you all can manage this now, right? So prevent community level impact. Okay. So counseling, if you all know, we have to spray again, do the spraying in a way so that we don't get it on our bodies, right? And we have to use PPE, right? And pesticides also have changed now. They are not as harmful as what they used to be, right? And early prevention is better. Otherwise, they can go into. Right. So take home message, ask about the occupation routinely, right? Even if they are 85, sometimes they are working. Link symptoms to work, right? Try to see whether there is a link between work and the presenting, not the only the presenting, only the symptoms, right? Early interventions to change the outcome. This early part is very, very important, because once secondary changes or complications happen, we can't undo them. And also, this is again very, very important, documenting carefully and correctly, right? Otherwise, we will fall into trouble. Every GP is an occupational health practitioner. This is very, very important for all of you all, because we are the gatekeepers for the health of the workforce. Right. Thank you. I hope it was informational. We can take the questions now.
Thank you very much, Dr. Asela. Yes, for that very informative presentation. Yes, let's go into the questions. Yeah, so I will ask the first question that was posted here. What is the place for personal safety items such as helmets and eye guards in risk occupation? Is there any protocol or guidelines regarding this?
Helmets, yeah, depending on your job, right? If it is formal, if it is a formal occupation, you have to wear helmets. Like say, if someone is a bike rider for a company, they have to wear helmets, and also by law, they have to wear helmets. But if you are talking about helmets where in a construction site, it is mandatory, right? Depending on the job. I mean, not the office workers, but construction site, it is mandatory. If the job profile says you have to wear protective eyeglasses, again, in the formal sector, it is prescribed. You have to wear, right? Say arc welding, then if they are working on lathes, because shrapnel can injure the eye, right? Because we have to make them understand, because it is for their own safety. But the informal sector, there is no one to implement these rules. I hope I have answered your the question.
Thank you, sir.
Yes, sir. The next question is, can a GP issue a fitness for work certificate or need a certificate from a relevant consultant, for example, for back pain?
It will depend on the back pain, right? Definitely, a GP can issue a medical certificate, but not for say 2 weeks, 1 month, 3 months. I mean, we can't do that. Then we will have to send to a orthopedic surgeon or rheumatologist or whatever, depending on the condition, right? But for say a week or maybe 5 days, we'll say there are no rules and regulations. I would say for 5 to 7 days we might accept, because all these medicals, when they are submitted to a company, I mean, these medicals are written to submit somewhere, so it is generally the company. So they will go through the medical and think, okay, whether this person is actually sick or whether he can actually do the job or whether he's just taking leave, right? So that will go through the HR process. So if you are giving a genuine medical, I think even up to a week you should be able to give, right? But not for 2 or 3 weeks or months.
Right. The next question is, give us some examples of fitness certificate for a particular disease or after surgery, and how to judge the period according to their work.
Which is a very, very difficult, very broad question, right? So after surgery, definitely, I think it will be always better to get the fitness certificate from the surgeon, because if you are confident, you can give, but if not, it is always better, say after the fracture, right? It is always there are standard protocols in the hospitals where they give, right? And if you look at it from the patient's perspective, getting it from an orthopedic surgeon regarding a fracture, will say, will be more relevant, because that's the because fractures are not within our normal purview, right? But for example, what is the condition that we can think of? Say asthma, acute asthma, right? Someone has had acute asthma and was not admitted, but we have managed, we have nebulized and done everything. That I think we can give, but we have to specify whether he can be sent back to the the same place of work, or he needs a change, because acute asthma, no, right? So, I mean, it's very difficult to answer. If you give a specific condition, we will be able to tell, but otherwise it's very difficult. But I think it's always better not to give medicals for long periods. Less than 1 week would be best.
Right. The next question regarding medical certificates issued by a doctor that relevant for insurance purposes. Is there any special considerations that we have to be careful, because people can use them for false claims? Should not the insurance company or the company, when relevant for occupation related injuries or hazards, have their own doctors to access those claims and patients? Is mentioning on the medical certificate not valid for insurance purpose a successful defense for use in legal problems?
Right. So, like I said, mentioning any form of not cannot be submitted here, there, anywhere is not legally, I think, valid, because it's a legal document. You are saying this person has this condition, right? So I think we can't say it is not for legal purposes. We can't say that it is not for court purposes, or we can't say that it is not for insurance purposes. But like it was mentioned, insurance companies have their own doctors who go through these medicals, right? So, and also they have a way of calculating the risk, right? So, I mean, they also know, we also know that a lot of doctors, or not a lot maybe, we feel, okay, we know our patient has we'll say hypertension. For the past 3 years, we don't mention that to bring down the premium, right? That we have to pay, right? But in the longer term, insurance companies knows that if someone presents with the complications of hypertension, it has been there, so they collect all this information. So I think, I mean, all in all, it's always better to disclose and be truthful. I don't know whether I answered the question completely.
Okay. All right. The next question is, the GP almost uniquely deals with the individual who works from early morning to very late at night. The job description ranges from most menial curls to those that require very high managerial level decision making. I'm referring to the housewife or homemaker. Is it the GP's duty to identify the risk, both physical and mental, requesting occupational command of the college to take up because of the second booth at home?
Uh, so if we call this lady a worker, right? So it will fall into informal working category, right? So informal working category, it's a bit of a dicey thing because there are no rules and regulations. We can't say you are doing this, that, and the other, right? It is for the family, it is their own thing, right? So in that situation, what I would advise is to show the, the good side and the bad side, and that they can't go on for long without, long term, without addressing these issues. That will be the best way, right? Because I think it might not be, because you might be entering into an area where their family matters might be the main issue.
Right. The next question, I think this was discussed, but anyway, this question has come in. Can we mention the diagnosis in the medical certificates? Is it not a breach of confidentiality then?
Yeah, so that we have discussed, right? But we mentioned the medical condition, right? Because even in government medicals, it is mentioned the condition, something like that, right? But when you really look at ethics, we should not, right? But it has not become like we discussed, I think, like one of you all said, unless it is very, very harmful to the person, we are not, say, fracture, we are not worried. But if someone has HIV, we might be worried. If someone has, we discussed psychological issues, we might be worried, right? But I think in the government sector also, they are issuing medicals saying that treat for depression, even they have diagnosis cards, right? So that issue has not been really taken up in Sri Lanka, and we are very complacent about whether we are writing or not. So I think if the patient says not to write, we cannot write.
All right.
Yeah.
The next question is something similar regarding a simulated situation like that the airplane crash. Think hypothetically, if a person comes for a treatment for a disease, we know if he drives or operates heavy machines, it will be a public hazard. But we do not know where he works. Should we actively seek the employer's details, or we have to inform authorities only if relevant authorities ask from us?
Actually, in the Road Traffic Act, if we think that someone is not fit to drive and is a danger on the road, we can not that we can, we have to inform the RMV, right? So similarly, I think it is our responsibility if someone is a risk to the public, right? But like it was said, I mean, if we don't know where he's working, it might be an issue because they might give a false address also, or the workplace. But these are all, I think, we have to discuss in a very positive manner with the person, because I'm sure they will understand the importance of preventing harm to others also. But it is a legal requirement under the law.
The next, yes, sorry.
Yeah, go on, Pooja.
Regarding medical insurance, are we legally bound to issue medical certificates for patients? Is it must if they ask for?
If it is our patient, it is our responsibility to issue a medical, because it is our patient, right? But we don't have to issue. That's why I said we don't have to issue, even if it is our patient, that patient has been treated by someone else, and you don't know who it is, and if that person has not issued, we need not worry about that part. We can issue for the part that we are treating, right? So it is our responsibility towards the patient. If we have treated, that we have to give a medical, and also normally medicals cannot be charged. We can't charge anything for the medical.
Right. How are hospital staff working in radiology monitored since they have a higher exposure to radiation?
Yeah, they have tags, they have schedules, they have other, I mean, their rooms are outside now, because those days they had to go in. Now it is done outside. A lot of changes have come in, and the machines are better. They issue less radiation out, I mean, outside the process, I mean, the area. They have come a long way.
Right. I think that's all the questions that have come across. Is there any other questions that anyone would like to ask? You can unmute your mic and then ask the questions. Right. In the absence of any other questions, I would like to thank Dr. Asela Anthony for taking his valuable time to present this lecture. Thank you very much, Dr. Asela. And I would also like to thank all the participants for joining in. Thank you very much. Have a good evening. Thank you.
Thank you to all, and thank you, Punijit. All the best.
Thank you, Dr. Asela. Thank you very much.